is mental illness? Or when can we say someone is mentally ill? The concept of mental illness is one that is grossly misunderstood by many people, especially in developing societies like ours. To a lot of people, mental illness means a deranged person who is out of touch with reality, disheveled, unkempt, roaming the streets, violent, and to be avoided. This is not true. Mental illness is not all about the mad man or woman. Yes, some type of mental illness may progress to aimless wandering on the streets, but there are many factors that cause this. Also, this type represents only a fraction of the scope of mental illness. Mental illness, on the contrary, is quite common and varied. Research indicates that 1 in 5 persons will experience it in their lifetime. In fact, anyone can experience it. Although we have different degrees of susceptibility, no one is immune. For a better understanding, how then can we define or describe mental illness? Mental illness is abnormal mental functioning. The word mental simply refers to the mind. The mind is what makes us human, and our mind is resident in the biological organ of our body called the brain. The brain is the control center of the body and the seat of mental functioning, that is, the residence of the mind. It controls all voluntary and involuntary actions. The mind is constituted of those parts of the brain that mediate our thoughts, emotions, perceptions, motivations, social interaction, and regulation of our purposive behavior. So, mental illness or disorder refers to any abnormality in any of these functions. Mental disorders are brain-based conditions. Any aberration in the thought pattern, emotions, or behavior is called a mental disorder. Fortunately, in the last 4 decades, there have been tremendous advancement in technology and research. We now understand better how many things work. There have been groundbreaking researches into how the brain works, and this have led to a trenchant understanding of the brain and mental disorders. Mental disorders are biological illnesses like other bodily conditions such as diabetes, hypertension, arthritis, glaucoma, and so on. They are not the result of flaws or deficiency in someone's willpower. They disrupt a person's thoughts, emotions, behavior, and functioning in relationships, work, academics, or other areas of endeavor, and they preclude a person functioning at full potentials. It has also been proved beyond any doubt that mental health is key and central to complete health and well-being. Just like other organ systems in the body, there are different types and severities of mental illness. Take, for example, the cardiovascular system, that is the heart and the blood vessels. Problems can arise in one or more of these parts. That is, problems can arise either in the heart chambers or veins, or in the arteries or the capillaries. There are myriads of possible cardiovascular disorders with different causes, symptoms, signs, trajectories, and complications. For example, hypertension, heart failure, abnormal heart rhythm, stroke, heart attack, and many others. To say that cardiovascular disorders is all about stroke, or that stroke is a manifestation of all cardiovascular disorders, will be grossly incorrect. In the same vein, there are different types of mental illness which affect different aspects of the mental system. There are many varied types of mental disorders, and they exist on a continuum. Some are mild and interfere partially with functioning. Some are severe, significantly affecting functioning and requiring more intensive treatment. Mental disorders are often categorized according to the dominant domain of mental functioning affected, although multiple areas are usually affected. Why? Because all aspects of our mental functioning are interconnected. Your emotions affect your thoughts, and your thoughts also affect your emotions. Both affect your behavior. Thus, your behavior is a reflection of your subjective mental experiences. Let us consider some classes of mental illnesses or disorders and the parts of mental system that is affected. Depression, bipolar disorder, anxiety disorder are examples of mental disorder that affect largely the mood. Schizophrenia is an example of mental disorder that affects majorly the thinking and perceptual domains. Pervasive developmental disorder or autism affects many aspects of the mental system, including communication, emotional reactivity, interest, and more. Whichever type 1 experiences, they are largely treatable, and one can live a normal life and achieve set goals in life if treatment is instituted in time. Mental illnesses present in different ways depending on the affected domain or domains of the mental system. Some are easily noticeable by others, while some are very covert and may not be easily noticed by the untrained eyes, but by people with very keen observation who have seen changes in the individual, such as close family members. It is easy to spot mental disorder in someone when it begins to affect their behavior. Why? Because the behavior is clearly seen. So, for example, people may easily notice a colleague at work or someone who starts looking unkempt or ungroomed or wearing inappropriate clothes. However, when it involves majorly subjective mental experiences like the thoughts or the perceptual processes, the manifestation, that is, the objective signs of illness, may not be as dramatic, especially in the early stage of the illness. So, your friend or colleague may be experiencing a mental disorder, and it may not be apparent initially that the person is experiencing mental distress within. What this means is that the fact that someone appears dapper does not necessarily mean that he or she is mentally healthy. In fact, a snazzy individual may be very ill, and only those close to him or her or the trained eyes will notice changes not outrightly apparent to others. Most often, when people are suffering from mental disorders, especially in a society where mental illness is ignorantly and highly stigmatized, they tend to conceal it under a facade of normalcy, especially in the earlier stages. However, they may not be able to continue to hide it as the illness progresses and a larger part of their daily functioning is affected. It is easier for people to appreciate and clearly delineate consequences of physical illnesses like, for example, blindness, stroke, or renal failure on health and functioning, whereas those caused by mental illness are deceptively obscure to most people. The burden, however, is more pernicious. That is, the outcome of untreated mental illness is much, but it may be still there. The impact or burden of poor mental functioning on health and productivity is grossly underestimated. Many people incorrectly believe that the suffering experienced in physical illness is much more than that from mental illness. This is absolutely wrong and has been proven to be otherwise. People feel illnesses are not burdensome as long as one can still move around, talk, or do some little everyday things. They believe severe illnesses are that which make you confined to the bed or hospital. This is not true. In fact, research has shown that mental illnesses are very disabling as other bodily illnesses, and sometimes even more than most physical illnesses. For example, research has shown that depression is like being blind and is comparable to paralysis in the two lower limbs. The meaning of this is that the degree of disability experienced in both conditions, that is, in blindness and depression, are the same. Picture someone who can't walk because he's paralyzed in both legs. This individual is going to be grossly limited in the quality and extent of what he can do without the help of an ambulatory tool like a wheelchair or prosthesis. The same thing happens in untreated depression. There is great limitation of productivity because your functioning depends on your mental well-being. Schizophrenia, which is another example of mental illness, is like being crippled in all four limbs. Because of the low knowledge about mental illness and the stereotypical portrayal of mental illness as madness, creating so much unwarranted stigma around such an important and delicate subject of human existence, people prefer to refer to it by other names like psychological disorder or nervous breakdown or behavioral disorder, whichever you choose or whichever you are more comfortable with. It is important that you understand that mental illnesses are biological illnesses like other bodily ailments. The word mental is a simple and innocent word misunderstood for a long time. Mental functions are executed by the brain, just like digestive functions are executed by the gut, breathing or respiratory functions by the lungs, and blood circulation by the heart. Therefore, mental illnesses or disorders are not to be trivialized or dismissed or left untreated. In summary, mental disorders are biological conditions like other health conditions such as diabetes, hypertension, arthritis, and so on. They are brain-based conditions which can be and should be promptly treated. There are evidence-based treatments. Recovery is possible and affected persons can get back to a fully functioning state. There is therefore no reason to be ashamed or hide. I don't think people get so ashamed that they hide having malaria or avoid seeking prompt treatment for typhoid fever. If you or any of your loved ones experience symptoms probably indicative of mental illness, see a psychiatrist. It doesn't mean you are mad. There is a broad range of mental illness. There are many other mental illnesses that may not present with weird symptoms, but still cause serious mental distress and suboptimal functioning. This is the 21st century. Do away with all archaic beliefs that mental disorders are shameful or a sign of weakness. Your psychiatrist will diagnose you correctly, outline and institute the appropriate intervention, and make referrals to other mental health professionals like the clinical psychologist, occupational therapist, speech therapist, and so on, as needed. Medicine is a highly specialized discipline, deeply technical and nuanced, with many subspecialties that handle specific areas of human health and illness. Even when you don't know where to go, start with your family doctor. He or she will guide you appropriately. Thank you for listening.